Hi and welcome to our telehealth video information series. I'm Garvin and this video is on Estrogel. So what is Estrogel used for? It's used for hormone replacement therapy to relieve symptoms of the menopause. As it only contains estrogen, Estrogel can be used on its own by women who have had a hysterectomy. Also, women who have not had a hysterectomy should also be prescribed a progestogen medicine to take with this medicine for the last 12 to 14 days of each month. This is because estrogen stimulates the growth of the womb lining or endometrium, which can lead to endometrial cancer if the growth is unopposed. A progestogen is given to oppose estrogen's effect on the womb lining and reduce the risk of cancer, though it does not eliminate this risk entirely. So this is known as combined HRT. If a woman has had her womb surgically removed, so that's a hysterectomy, endometrial cancer is not a risk and a progestogen is not necessary as part of HRT unless the woman has had a history of endometriosis. It's also used as a second line option for preventing osteoporosis in postmenopausal women who are at high risk of fractures and cannot take other medicines licensed for preventing osteoporosis. Women considered to be at risk of developing fractures following the menopause include those who have had an early menopause, those with a family history of osteoporosis, those who have had a recent prolonged corticosteroid therapy, for example with prednisolone, and those with a small, thin frame, and those who smoke. So how does Estrogel work? Estrogel contains the active ingredient estradiol, which is a naturally occurring form of the main female sex hormone, estrogen. Women's ovaries gradually produce less and less estrogen in the period up to the menopause, and estrogen blood levels decline as a result. The declining levels of estrogen can cause distressing symptoms such as irregular periods, hot flushes, night sweats, mood swings, and vaginal dryness or itching. Estrogen, in this case in the form of estradiol, can be given as a supplement to replace the falling levels in the body and help reduce these distressing symptoms of the menopause. This is known as hormone replacement therapy or HRT. HRT is usually only required for short-term relief from menopausal symptoms, and its use should be reviewed at least once a year with your doctor. HRT is also sometimes used to prevent osteoporosis in postmenopausal women. The declining level of estrogen in menopause can affect the bones, causing them to become thinner and more prone to breaking. Estrogen supplements help prevent bone loss and fractures that may occur in women in the years after the menopause. Estrogel is an estrogen-only form of HRT. The gel is applied to the skin and the estradiol is absorbed through the skin into the bloodstream. So how do you use Estrogel? You follow the instructions provided with your Estrogel carefully. Estrogel should be applied once each day to a clean, dry, unbroken, non-irritated area of skin on the arms, shoulders, or inner thighs. You should apply 2 measures of the gel to an area of skin twice the size of the template provided with the medicine. After applying the gel, let it dry for 5 minutes before dressing and do not wash the area or apply other skin products such as creams and lotions to the area for at least 1 hour. Do not apply the gel on or near the breasts, vaginal area or face. Avoid getting the gel in contact with your eyes and wash your hands after applying the gel. You should only apply the gel yourself. Do not let someone else apply it for you. Avoid skin contact with another person, particularly male, for at least 1 hour after applying the gel. You should avoid using strong skin cleansers and detergents, skincare products with a high alcohol content, and keratolytics such as salicylic acid on the areas of skin where you're applying Estrogel. You should try and apply the gel at the same time each day. If you forget to apply it at your usual time and it is less than 12 hours late, you should apply the mist application as soon as possible and then carry on as usual. If you forget to apply the gel and it is more than 12 hours late, you should leave out the mist dose and just apply your next dose as usual. Do not apply a double dose of gel to make up for nearly a missed dose. Ester gel should be used with caution by women with a risk of developing cancers that are stimulated by estrogen. For example, women whose mother or sister has had breast cancer, and women with a history of benign breast lumps, also women with fibroids in the womb, women with a history of endometriosis, women with a history of overgrowth of the lining of the womb. And estrogel should not be used by pregnancy and breastfeeding. This medicine should not be used by women who are pregnant or breastfeeding. You should stop using the medicine and consult your doctor immediately if you think you could be pregnant during treatment. A woman is considered fertile for 2 years after her last menstrual period if she is under 50, or for 1 year if she's over 50. HRT does not provide contraception for women who fall within this group. If you could get pregnant while using this HRT, you should use a non-hormonal method of contraception. So seek further advice from your doctor if this relates to you. Possible side effects of estrogel would be gut disturbances such as nausea and vomiting, abdominal pain, bloating, flatulence and indigestion, and menstrual bleeding or spotting, vaginal thrush, increase in the size of uterine fibroids, breast pain, tenderness or enlargement, and fluid retention causing swelling, headache or migraine, premenstrual-like symptoms, depression, anxiety or mood changes, and changes in sex drive. So the side effects I've just mentioned does not include all the side effects reported by the manufacturer. For more on any other risks or possible side effects, you need to read the patient information leaflet that comes with the medicine or talk to your doctor or pharmacist for more. How can estrogel affect other medicines? You should avoid using strong skin cleansers and detergents such as benzalkonium, skincare products with a high alcoholic content, so astringents and sun creams, and keratolytics on the same area of skin where you apply estrogel. Do not apply other skin products, creams and lotions to the area where you are applying estrogel for at least 1 hour. And the following medicines may potentially reduce the blood level and effect of this medicine, which could cause irregular menstrual bleeding or your symptoms to come back. So aprepitant, bosentan, barbiturates, carbamazepine, esylcarbazepine, and modafinil. Some women with diabetes may need small adjustments in their dose of insulin or anti-diabetic tablets while using this medicine. You should monitor your blood sugar and seek advice from your doctor or pharmacist if your blood sugar control seems to be altered after starting this medicine. This medicine may oppose the effect of medicine used to lower high blood pressure. Your blood pressure will usually be checked periodically while you're using HRT. But this is particularly important if you're also taking medicines for high blood pressure. This medicine may also oppose the fluid losing effect of diuretic medicines. This medicine may decrease the amount of the anti-epileptic medicine lamotrigine in the blood, as this could increase the risk of seizures coming back or getting worse. The medicine may not be recommended for women who take lamotrigine on its own for epilepsy, and this medicine may increase the blood levels of the following medicines. This could possibly increase the risk of their side effects. So aminophylline, selegiline, theophylline, and tizanidine. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through my website, mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.